I love clinical practice, but in public health, you can impact more than one person at a time. The whole society is your patient. Welcome, learners. My name is Dr. Leon, and today we will go over the introduction to public health. Today we will discuss several interrelated topics that, taken together, provide an introduction to public health. These are our course topics for today as shown on the slide. We will begin this course with an overview of what public health is, along with key terms associated with public health. Charles Edward Amory Winslow is a leading figure in the development of the modern study of public health. His definition of public health, developed almost a century ago, is as follows. Public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. Note the influences at the broader societal and community levels as well as the individual levels. You will see examples of public health at each of these levels throughout this course. The Institute of Medicine states that the mission of public health is fulfilling society's interest in assuring conditions in which people can be healthy. Similarly, the World Health Organization stresses that public health aims to provide maximum benefit for the largest number of people. Public health focuses on groups of people rather than just an individual. At the core of public health lies the principle of social justice, providing people the right to be healthy and to live in conditions that will support their health. Now that we know what public health is, let's review some common terms. Please locate the document titled Public Health Key Terms in your participant handout. Knowledge check. Fill in the blank with the correct answer. Public health aims to provide blank with the right to be healthy and live in conditions that support health. The correct answer is groups of people. Knowledge check. Fill in the blank with the correct answer. An blank is a disease occurrence among a population that is in excess of what is expected for a given time and place. Correct answer is epidemic or outbreak. Now let's review the history of public health. We will take a look at a few historical highlights through 4 lenses: sanitation and environmental health, pandemics, disaster response and preparedness, and prevention and policy. The first lens we look through encompasses the control of disease and promotion of health through sanitation to ensure a healthy environment. Here are 3 examples of how public health has worked to contain infectious disease through environmental measures. Around 500 BCE, the ancient Greeks and Romans actively practiced community sanitation measures. Approximately 2 millennia later, the Public Health Act of 1848 was established. It provided a central board of health and placed responsibilities for sanitation in the hands of the boroughs. In 1970, the Nixon administration established Environmental Protection Agency, which protects human health by safeguarding air, water, and land. Next, we will explore pandemics. Pandemics are epidemics or outbreaks of disease that spread far and wide, affecting the populations of multiple continents. Influenza or the flu has caused pandemics many times during both the distant past and recent history. Almost a century ago, the Spanish flu infected 500 million people across the world, including remote Pacific islands and the Arctic, killing 20 to 50 million persons. More recently, the influenza pandemic in 2009 infected persons in 214 countries, causing almost 19,000 confirmed deaths. Preparing for and controlling the effects of influenza will likely remain top priorities of public health. Historically, polio was a common and highly feared disease that caused severe illness, including paralysis and death among thousands of people each year. Thousands of people lined up to receive the polio vaccine after it was introduced in 1955. An initiative to eradicate polio was launched in 1988 because of outbreaks in more than 125 countries. Today, polio exists in only a few countries. During the 1980s, human immunodeficiency virus, or HIV, emerged and spread rapidly across the globe. Public health has responded to this pandemic by developing new ways to diagnose and treat those who are infected. New infections of HIV are down 20% over the past 10 years, which is a sign that public health interventions are successful. The third area we'll explore is public health's role in preparedness and disaster response, both for natural disasters and human-made threats. The use of biological warfare to infect people and animals goes back to centuries. During the siege of Kaffa in the 14th century AD, the attacking Tartar forces used plague as a weapon of war by hurling plague-infected corpses into the enemy's city. Their action started the first stage of the Black Death or plague among Europeans. In the immediate wake of the terrorist attacks on September 11, 2001, public health workers were on the ground at the World Trade Center and the Pentagon, conducting surveillance to identify outbreaks of diseases or other possible health conditions resulting from the attacks. Public health workers closely monitored the health of first responders, city residents, and environmental conditions to detect health threats during the cleanup after the attack. After Hurricane Katrina in 2005, public health workers and other disaster relief agencies tirelessly provided emergency services. Teams were dispatched to conduct surveillance for illness and injury among people who evacuated to shelters and other places of refuge after the storm. The last lens we look through as we view public health history is prevention and policy. Public health works to protect and improve health not just by responding to disease outbreaks or preparing for natural or human-made disasters, but also by implementing policies that support these effects on a societal level. As far back as 1500 BCE, Leviticus, the third book of the Hebrew Bible, is believed to be the first written health code in the world. The book deals with personal and community responsibilities and includes guidance regarding bodily cleanliness, sexual health behaviors, protection against contagious diseases, and isolation of lepers. During 2000 to 2004, cigarette smoking was reported to be responsible for $193 billion in annual health-related economic losses in the United States. Laws banning smoking in the workplace and other public places have been developed to encourage smokers to quit while protecting non-smokers from the effects of secondhand smoke. Finally, more than one-third of the U.S. adults and approximately 17% of children and adolescents aged 2 to 19 years are obese. Efforts to highlight fat, sugar, and salt content in the foods through labeling regulations have been developed along with the promotion of physical activity in schools, workplaces, and neighborhoods. In New York City, the mayor and city council attempted to ban sodas larger than 16 ounces in an effort to combat the obesity epidemic. Knowledge check. Which of the following events in public health history have been pandemics? Select all that apply. B and C, influenza and polio. Let's talk about public health in a broader context. Public health problems are diverse and can include infectious diseases, chronic diseases, emergencies, injuries, environmental health problems, as well as other health threats. Regardless of the topic, we take the same approach to a public health problem by following 4 general steps. First, we ask, what is the problem? In public health, we identify the problem by using surveillance systems to monitor health events and behaviors occurring among a population. After we've identified the problem, the next question is, what is the cause of the problem? For example, are there factors that might make certain populations more susceptible to disease, such as something in the environment or certain behaviors that people are practicing? Once we've identified the risk factors related to the problem, we ask, what interventions works to address the problems? We look at what has worked in the past in addressing this same problem, and if a proposed intervention makes sense with our affected population. In the last step, we ask, how can we implement the intervention? Given the resources we have and what we know about the affected population, will this work? As we go through this course, you will see different examples of this public health approach at work. To implement the public health approach, practitioners use and apply scientific methods. These methods come from a series of core sciences that provide the foundation. These sciences include public health surveillance, which we use to monitor a public health situation. Epidemiology enables us to determine where diseases originate, how or why they move through populations, and how we can prevent them. Public health laboratories support public health by performing tests to confirm disease diagnosis. Laboratories also support public health by conducting research and training. As we continue to move from the use of paper documents to electronic health records, public health informatics continues to increase in importance. Informatics deals with the methods for collecting, compiling, and presenting health information. It enables us to use electronic data effectively when addressing a public health situation. Prevention effectiveness is closely linked to public health policy. Prevention effectiveness studies provide important economic information for decision makers to help them choose the best option available. Together, these 5 core sciences can help us protect and promote the public's health by giving public health practitioners the answers they need. Public health is better able to respond to the situation by using contributions from each of these sciences. One science alone cannot answer the questions and provide a solution. It is the application of these core sciences together. For example, let's look at the public health problem of influenza. Public health surveillance can monitor when and where cases of influenza occur each year. Professionals use the science of epidemiology to understand why different populations choose to get vaccinated against influenza. They can use the science of informatics to analyze and receive electronic information from healthcare institutions to determine whether persons who get this influenza go to see a doctor and whether they get well or die. Public health practitioners can use laboratory science to determine whether persons with fever and cough have influenza or a different infection, and they can use prevention effectiveness to show that influenza vaccination campaigns that might cost $200,000 can prevent $1 million in medical costs, lost wage, and other costs. Let's look at how the public health approach can be applied to a historical example of an infectious disease. During the early 1800s in London, cholera, a fatal intestinal disease, was rampant, causing death to tens of thousands of people within hours of the first symptoms. At the time, which was before bacteria and viruses were recognized as the cause for many diseases, popular opinion held that cholera was caused by bad air coming from rotting organic matter. John Snow, a British physician during that time, had a different opinion of cholera. He believed that illness was spreading by way of a contaminated water supply because sewage was routinely dumped into the Thames River and cesspool near town wells. Because of his work tracing the source of the cholera outbreak, he is often considered the father of modern epidemiology. His research changed the way we look at disease. Now, let's apply the public health approach to Snow's research of the cholera outbreak. What is the problem? Snow conducted public health surveillance by looking at where those with cholera lived in London. He saw that larger clusters of the cases were occurring in specific areas. The red circle depicts the neighborhood in question, and the black dots represent the deaths from cholera. Notice the higher density of deaths around Broad Street. Snow was assisted by a local clergyman, Reverend Henry Whitehead, in tracking down and interviewing cholera victims and their families, and geographically mapping the outbreak. Their efforts highlight the benefits of linking scientific inquiry with engagement of community stakeholders and shared ownership for health. Next, he examined the data and tried to identify risk factors. That is, he tried to determine the cause of deaths by using the pattern of where cases were occurring. This slide illustrates the location of the water pumps, which are indicated as black boxes. On the basis of his previous work, Snow believed that water was a potential cholera source. The map reveals that the largest number of cholera cases occurred in areas near neighborhood water pumps. This observation prompted Snow to further research the distribution of water pumps in London. He identified where people who had cholera were drawing their water. His findings indicated that clusters of cholera cases were more commonly located around certain pumps, particularly the Broad Street pump. Through his research, Snow concluded that drawing water from the Broad Street pump was a primary risk factor for becoming ill with cholera. After identifying likely risk factors, the next step in the public health approach is evaluating potential interventions. What interventions will work? With the water supply from the Broad Street pump identified as the risk factor, Snow then worked to identify interventions to address the problem. Through continuous research, Snow understood that the interventions required to control the cholera outbreak needed to stop exposure to the contaminated water supply, and on a larger scale, stop exposure to the entire supply of contaminated water in the area. Using the final step of the public health approach, Snow implemented the intervention by removing the handle from the Broad Street pump so no one could continue to draw water from the contaminated water supply. After a long battle with politicians and water companies, he finally convinced the British government that water contaminated with sewage was the source of cholera and other diseases, which resulted in the implementation of policies and laws for water sanitation. Knowledge check. Fill in the blanks with the correct answers. Each public health core science helps us to blank and blank the public's health by providing public health practitioners with answers they need. The correct answer is protect and promote. Knowledge check. Match each component of the public health approach with the questions they answer. First, what is the problem? B. Surveillance. What is the cause? A. Risk factor for identification. What works? D. Intervention evaluation. And how do you do it? C. Implementation. Now let's look at the core functions and services of public health. In 1988, the Institution of Medicine defined 3 core functions of public health agencies that must be carried out at all levels of government for the overall public health system to work effectively. The 3 core functions are assessment, policy development, and assurance. Assessment is knowing what needs to be done. Policy development is being part of the solution to get it done, and assurance is making sure it gets done. 10 essential public health services are grouped under the 3 core functions. These services are not a prescription for what public health agencies should be doing. Instead, they are intended to serve as a descriptive tool to capture the field of public health and to communicate what public health provides. Now let's think about how these essentials can be implemented. We'll use tobacco use prevention as an example. So what might be examples of how each essential service can be used in tobacco prevention? So first, assessment. We monitor health status, monitor smoking use among segments of the population such as the youth, diagnose and investigate health problems. We investigate risk factors associated with tobacco use. In terms of policy development, we inform, educate, and empower people about health concerns. That we place public service announcements on television regarding the dangers of smoking. Another step is mobilize community partnership. Basically, we work with advocacy groups to develop anti-smoking interventions that will work in a specific community. We also develop policies and plans, such as passage of Proposition on 99, the cigarette tax to fund anti-smoking campaigns, or smoke-free workplace places, apartments, complex, and other shared spaces. And then lastly, assurance, enforcing laws and regulations. We enforce enforcement of policies and laws such as placement of cigarette vending machines. We link people to needed personal health services by addressing potential barriers related to culture and the language of materials, or staff serving special population groups. In California, ads in tobacco control media campaign were broadcasted in Spanish and Mandarin as well as English. Another key note is assure a competent public health personnel healthcare workforce. We want to ensure a knowledgeable workforce is in place to develop and implement the anti-smoking campaign. We also want to evaluate effectiveness, an ongoing evaluation of the campaign to ensure it works as desired, determining how it might be improved. Lastly, research for new innovative solutions to public health programs. We take insights gained from the field on what works and confirm them through a collaboratively study with health researchers. The core functions, assessment, policy development, and assurance must be carried out at all levels of government, that is your federal, state, and local, for the overall public health system to function effectively. Looking at tobacco use again, here are few examples of each function at the different governmental levels. Which of the following is not a core function of public health? The correct answer is C, authority. The essential health services of monitoring health and diagnosing and investigating disease relate to which core public health function? Assessment. Levels of prevention. Corresponding preventive health measures have been grouped into similar stages to target the prevention of these stages of disease. These preventative stages are primordial prevention, primary prevention, secondary prevention, and tertiary prevention. Combined, these strategies not only aim to prevent the onset of disease through risk reduction, but also downstream complications of a manifested disease. In 1978, the most recent addition to preventive strategies, primordial prevention, was described. It consists of risk factor reduction targeted towards an entire population through a focus on societal and environmental conditions. Such measures typically get promoted through laws and national policy. Because primordial prevention is the earliest prevention modality, it is often aimed at children to decrease as much risk exposure as possible. Primordial prevention targets the underlying stage of natural disease by targeting the underlying social conditions that promote disease onset. An example includes improving access to an urban neighborhood, to safe sidewalks, to promote physical activity. This in turn decreases risk factors for obesity, cardiovascular disease, type 2 diabetes, and so on. Primary prevention consists of measures aimed at a susceptible population or individual. The purpose of primary prevention is to prevent a disease from ever occurring. Thus, its target population is healthy individuals. It commonly institutes activities that limit risk exposure or increase the immunity of individuals at risk to prevent a disease from progressing into a susceptible individual to subclinical disease. Remember, while primary prevention is about treating risk factors to prevent cardiovascular disease, primordial prevention refers to avoiding the development of the risk factors in the first place. Secondary prevention emphasizes early disease detection, and its target is healthy appearing individuals with subclinical forms of the disease. The subclinical disease consists of pathologic changes, but no overt symptoms that are diagnosable in a doctor's visit. Secondary prevention often occur in the form of screenings. For example, Papa Nicolau or Pap smear is a form of secondary prevention aimed to diagnose cervical cancer in its subclinical state before progression. Same thing as your mammogram. Tertiary prevention targets both the clinical and outcome stages of a disease. It is implemented in symptomatic patients and aims to reduce the severity of the disease as well as any associated sequelae. While secondary prevention seeks to prevent the onset of illness, tertiary prevention aims to reduce the effects of the disease once established in an individual. Forms of tertiary prevention are commonly rehabilitation efforts. In this slide, dialysis is considered a tertiary prevention. The field of public health is broad and interdisciplinary. Beyond government, it requires stakeholders with skills in intervention programs, policies, research, evaluation, and education. What other sectors and fields can you think of that have a stake in public health? Possible answers could be housing, transportation, schools, city planning, or law enforcement. Other partners include governments, community groups, clinical care, employers and businesses, and media and academia, in addition to the infrastructure provided by the government at all levels. Non-governmental organizations, often referred to as NGOs, play a key role in public health, especially at the community level. NGOs serve many different purposes, from advocacy or education to emergency relief and economic development. General types of NGO include professional membership organizations such as the American Public Health Organization, organizations that focus on a specific health problem such as the American Cancer Society, citizen groups such as the Americans for Non-Smokers' Rights, and foundations that support health projects and work at the policy level such as CARE, which fights global poverty, and the Bill and Gates Foundation, which funds public health projects in the world. Healthcare plays a vital role in protecting and promoting the public's health along with public health organizations. The two have differences that are worth highlighting here. Public health focuses on populations, while clinical care focuses on the individual patient. Healthcare and public health are complementary. When they work collaboratively, all people benefit. Here are some of the other primary partners in public health. Increasingly, social media serves as a vehicle for the public's discourse on public health concerns, and historically, public health agencies and other partners have educated the public and promoted healthy behaviors through the news and entertainment media. Employers and businesses contribute to the public's health by providing health insurance, for example. Workplaces also have wellness initiatives such as gym subsidies that promote the health of their employees. Government agencies such as CDC work in partnership with state, local, and tribal health departments. However, important contributions are made by other government agencies at all levels. City planning departments can include sidewalks and bike paths to promote and support safe ways to exercise. Education departments can include public health messages for students, implement prevention in school health programs, and work to ensure healthy food options at school. Similarly, many other government agencies can work as partners in public health by including health considerations in their policy development. Academia educates and trains the public health workforce, such as scientists, epidemiologists, and informaticians. Additionally, research conducted in academia is put to use in the larger communities around the world and the United States. Knowledge check. Match each stakeholder to its role in public health. 1. Vehicle for public discourse. The correct answer is D. Media. Health in all health policies. The correct answer is C. Government. Education and training. The correct answer is A. Academia. Lastly, wellness initiatives and benefits. The correct answer is employers and businesses. As we discussed previously in the course, certain factors determine a person's state of health. Scientists generally recognize these health determinants for any population. These include genes and biology, health behaviors, social or societal characteristics, health services, or medical care. Now, what are some specific examples of each type of health determinants? So for your genes and biology, this will include sex, genetic makeup, and age. In terms of health behaviors, smoking, physical activity, and eating habits. With social or societal characteristics including the total ecology, discrimination because of income or sex, where a person lives, including especially air, water, and sanitation quality. And then medical care, the quality healthcare insurance or coverage. Other answers may include level of education achieved, income level, immunity levels, parenting, race and ethnicity, quality of surrounding built environment, and lastly, quality of schools and ability to work. This chart is an estimate of how these four major determinants influence health at the population level. Notice the portion of the chart that represents medical care. We spend trillions of dollars on healthcare, yet it only determines about 25% of our health. The remaining 75% of what determines our health as our population is our total environment or ecology, including the social environment which we live, plus our health behaviors, and a lesser extent, our genes and biology. An example of the roles of these determinants play in our daily lives is through nutrition and physical activity. Both are essential elements in producing optimal health and should be viewed in the context of such environmental factors as social and cultural norms that influence food choices and physical activity. Environmental characteristics such as availability or lack of healthy food, open space for exercise, or safety in urban neighborhoods, and sector influences such as the marketing of processed foods. All of these factors influence our individual choices, which in turn influence our overall health. To address the determinants on the slide we just discussed, we have to have a plan of attack or means to affect change. This pyramid describes such a plan, the impact of different types of public health interventions. As we move down the pyramid, the public health impact grows greater. However, as we move up the pyramid, the amount of individual effort increases. Starting at the top, we can do counseling and education, perform clinical interventions, have longer lasting preventive interventions, change the context in which people operate so the default decisions they make are healthy, and lastly, positively influence socioeconomic factors. A point to emphasize here is that we have to have trade-offs. We have to sometimes give up resources in one area to have a larger impact in another. Let's take a look at some more examples. This pyramid illustrates the impact of different types of public health interventions. Let's start at the top of the pyramid and work down. Counseling and education in clinical and other settings is regarded by some as the essence of public health action, but unfortunately it is not as effective as we would like. That being said, at times, counseling and education are the only forms of intervention available, and when applied consistently and repeatedly, can have an impact. Examples include warning labels on cigarette packs and campaigns to promote tobacco cessation. Moving to clinical interventions, ongoing medical care for a health condition is an example. In the case of cardiovascular disease, these interventions can have a considerable effect. However, we are limited by a lack of access to certain patients who need care and lack of adherence to medical instructions in the real world. Long-lasting preventive medicine interventions, vaccines for examples, prevent 2.5 million deaths among children around the world every year. In this case, a single dose or instance of an intervention can have a lifelong effect. We make health decisions by the default by changing the context in which behaviors occur, making it difficult to avoid intervention. For example, changing the laws to require seatbelt use in cars and banning smoking in certain public places have had substantial impact. At the base of the pyramid are public health interventions that affect socioeconomic factors. If we can improve quality of life by helping people out of poverty, providing basic sanitation, improving their access to education, healthy food, and medical care, we can greatly improve a population's chances for a healthy life. Knowledge check. List the 4 determinants of health: genes and biology, health behaviors, social or societal characteristics, and health services or medical care. Knowledge check. Fill in the blanks using the following choices. First question, as we move blank the health impact pyramid, the public health impact grows greater. Second, as we move blank the health impact pyramid, the amount of individual effort increases. So the first one is as we move down the health impact pyramid, the public health impact grows greater. And then as we move up the health impact pyramid, the amount of individual effort increases. Within each of the topics we have covered in this course, underlying all our actions and decisions is the application of public health core sciences. I encourage you to build on what you have learned in this course by learning more about how these core sciences contribute to public health by taking the introductory courses offered in this Public Health 101 series in Prevention Effectiveness, Epidemiology, Laboratory, Informatics, and Surveillance. So let's review the learning objectives for this session. During this course, you learned to describe the purpose of public health, define key terms used in public health, identify prominent events in the history of public health, recognize the core public health functions and services, describe the role of different stakeholders in the field of public health, list some determinants of health, recognize how individual determinants of health affect population health, and lastly, we learned about levels of prevention.